guys, welcome back to Medical Coding with Blue. Today's episode is all about, can you learn medical billing and coding with a learning disability? If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay, I'm going to say a few things first, but this episode was inspired by an email that I got, which I will read here in a minute. But I will start off by saying that there are two major medical coding associations. There is the American Health Information Management Association and the American Academy of Professional Coders. Both of these associations are the certifying bodies for medical coding, and they both offer accommodations for those who have disabilities. If you are interested in learning more, you can contact either one of them. I will leave the links in the description box below, so please be sure to check them out if this is something that you are interested in learning. I will also say this disclaimer part first about myself. People will ask me, hey, I have this disability, that disability, can I do this? Sometimes people are asking me, I feel like they ask me because they may think I may say no, and then they may say, okay, well, I'm going to prove her wrong. I'm never going to be that person for people. I believe that if, as adults, you want to do something, doesn't matter what is in your way, if you want to do it, you'll do it. That's the way that I have always looked at things. I also know that in this industry, there are people who have physical disabilities and there are people who have disabilities that we all can't see, but they make it work. And so that I know. I have seen many people who have, other disabilities like dyslexia who have to take the test a few times, but they eventually end up passing it. And they're able to learn it, and they use adaptive devices to help them. So that is there's always ways if you want to do something. We have to know what doctors know while never having gone to medical school. This is something that requires very good reading comprehension, not just good, but excellent reading comprehension, because these words are big. These words do not play. Medical terminology is a whole different language. It literally is. We have to be able to use numbers and letters, and these numbers and letters have to go in the correct order at all times. If you transpose numbers, if you change a number or a letter, this could potentially change the code or render the code invalid. So that's why we always have to make sure that we know things like this. All of our numbers and letters and reading comprehension, everything has to be good there because that's very key to what we do. We read 90% of the day, but there are other professional skills that we have to develop as medical coders and that a lot of people don't talk about. We have to be able to do public speaking, and we have to be able to communicate in English very clearly, okay? So if English is not your first language, people who English is not their first language do this all the time. But they have to make sure that they always work on their English so that they can get more proficient, and it would make reading the documents a lot easier. And when you are thinking, I have to be able to do public speaking, it comes in handy when you start working with providers. Now, some facilities will have one designated person to work with providers, and that's who does the speaking. So that's okay. But in the instance that they don't have that type of person, and it is on the medical coder, then you have to be willing to step up. You cannot simply say, I don't want to do this because I can't. Being in medical coding requires you to be selfless. This is a very selfless field because what we do affects so many people. It affects the patients, it affects the providers, it affects the facilities that we work for. And a lot of people will say this is a thankless job. It is. A lot of times it is. There are some employers that are better at recognizing their employees than others. But for the most part, it is pretty thankless. It is a selfless job. And you have to be willing to look at these encounters. You have to be looking at them with a critical eye. You have to be able to process them as quickly as well. You can't take forever on them because everything has to be done in a timely manner to send on to the insurance so that the insurance can process it and that provider or facility can make their money. So we have that responsibility. It is a huge responsibility. And I will also say that I will never discourage people, again, to do what it is that they want to do. But I will say that this field is not for everybody. And that if you're going to invest money into this, know that this is a commitment. This is not a fleeting thing. This is not something that you will only invest a little bit in. This is a lot of money, because once you do get through your program, whether you decide to do self-study or whether you decide to go through a trade school or one of the association online programs, the associations both have their own online programs, which is who I recommend going through, because I haven't been to any of these trade schools. So if you're going to go through them, go through them. But you want to make sure that you are prepared, because once you take your certification, which is going to be more money, right, that you have to take it, once you get your certification, you will have to maintain that certification every single year. And if you are taking your certification through the American Academy of Professional Coders, not only will you have to report continuing education units every 2 years, because you will get 2 years to report. For one credential, you will have to report 36 continuing education units. So not just that, you will have to pay $190 per year to AAPC for their membership. If you do not pay that membership fee, they will take your credential away. So that $190 is going to have to be paid for every single year. If it goes up, it goes up. But that is the fee. You have to be a member every single year. You have the AAPC credential. And as far as adding on additional credentials, because that's another thing that the viewer brought up in this email. When you are brand new and starting, all you need is one. You do not need a whole string of credentials. That is a sales tactic sometimes, and especially to new people. When you have experience, when you've been in the field for at least 2 years, then you can consider adding on additional credentials, because there are other specific credentials that make sense to add on. But you have to make sure that you're very careful about what you're spending more money to be able to maintain. And that's just my advice anyway. So here's the email. Hello, Blue. I discovered your YouTube channel literally at 2 o'clock this morning. I am extremely interested in becoming a CPC/CPB. Again, you don't have to be certified to be a biller, because when you look in the job listings, they're not asking for the CPB. But I have a learning disability that mainly involves not keeping information in my head for very long. I have multiple health problems that are affecting my brain by way of brain fog. Is this a career someone like me can do, or should I not even bother? Honestly, I have probably asked the wrong people this question, like recruiters for schools. It'll cost $3,500 for me to do AAPC's online CPC/CPB certification courses, and I obviously don't want to waste my time or money. Thank you for your time. The thing is, this field is a very good field. I love this field. I love the field of medical coding, which is why I fiercely talk about it a lot. I have over 800 episodes on my channel and currently over 18,000 organic subscribers. I don't pay to boost my show at all. This is just natural. My show, I put it out there and the people watch. So I will say that this field is not meant for everybody, that you have to really consider, again, what you're getting into. This is an intellectual field. It is going to require continual study, not just when you're in school, when you're in the program, not just until after you get your certification. This is every single year. This is why we have continuing education units that we must report for our medical coding certifications, because things change and guidelines get updated. The books get updated every year. There is a new edition of the ICD-10-CM, of the CPT and the HCPCS manual, the ICD-10 PCS manual, every single year. And sometimes codes get updated, sometimes they get deleted, sometimes there are brand new codes put in there, sometimes the descriptions of these codes change. So if you are prepared to do a lot of study, if you are prepared to get frustrated, because you will get frustrated, there will be things that do not make sense to you. But if it is your will to do what you want and get through that, then that's what you will be able to accomplish if that's what you really want to do. But I will say I will not encourage people who are looking at this for the money, who are looking at this because they want to do this remotely. For some, they are able to do this remotely. But because before the pandemic, if you did not have experience, you were not getting remote work as a medical coder. If you were brand new, you had to have experience. Now, sometimes people are still lucky to be able to get in, but other times people are going to want them to be at the facility or at the doctor's office to be able to work. So that I will say, if that's your sole purpose for getting in this, then I would discourage that. But that has nothing to do with having a learning disability, okay? It has everything to do with your purpose for getting into this. And now I've said many times for people that, you know, again, if you're getting into this for the money, you're getting into it for the wrong reason. Medical coders do make good money, and we don't talk money in specifics on my channel. I will always say that. I will never give specifics because every place in the US is going to be different as far as what they start their medical coders at. My channel is for talking about the career field and what to expect and how to be a better medical coder. That's what my channel is for. So I want you to be able to consider very carefully before you start getting into this. It's a lot of reading. You will have to have the ability to be able to retain information, because if you're not retaining information, you may struggle even harder. And so I don't know if for this person that it's because they haven't had a chance to study yet and they don't really quite know what they're going to get into. But I want you guys to keep this in mind. When you are doing this, it is going to require concentration. It is going to require you to actually get in there and do flashcards and listen to videos. There's a ton of videos on YouTube. If reading is not your thing, you can listen to videos on YouTube about medical terminology and anatomy and pathophysiology. There are tons of videos out there. There are tons of videos on surgeries. And surgeries and being able to read and understand operative notes it's very important to be able to do that as well. So if if you have a hard time just concentrating always on reading, but you're better at listening and watching videos, YouTube is a great place to start. You can type in pretty much any surgery and there's going to be a video about it. So that is an alternative for you to be able to help you to learn. There are medical coding tutors out there. There's a ton of tutors on LinkedIn. So you can always try to find a tutor if that is something that you need to supplement your studies. But it's a commitment, guys. If you want to do it, you absolutely can. But you have to make up your mind and you can't be ambivalent about it. You have to be willing to say, okay, I'm going to do this. And, I may have this hurdle in front of me, but I know I can work with myself in order to advance myself. And that's all I got. So best of luck to you out there. This is not something to enter into lightly. I will say that. Okay. But if this video helped you, I hope that you will share it. Like this, subscribe if you haven't already, and I will see y'all next time. Bye.